Robert McKinney, it's good to have you on Health. Bob McKinney.
Bob McKinney.
All right, thanks for joining us. It's good to see you again. Talking about anxiety, something we all deal with, and talking about PTSD, something we don't think we deal with, but many people do. We know much more about it now than we did, I'll bet, when you first started talking about it 10 years ago. Let's talk about anxiety first. Everyday anxiety. We all deal with that to some degree.
Correct. So anyone should anticipate feeling some kind of feelings of anxiety at some point in their lives.
Sure.
People get anxious about doing interviews. People get anxious about taking tests in school. People get anxious about their annual review at their job. All of this is normal.
Yeah. When do you cross the line to, okay, this is more than just a little anxiety. This is beginning to affect not only the way I behave, but the way I feel. I physically don't feel well. Will anxiety do that to you?
Oh, sure it can. So you might begin to think about moving from a normal level of anxiety to what we would consider an anxiety disorder if it begins to affect your day-to-day life, or if the symptoms persist for a long time.
And there are people that deal with that in everyday life. They have an elevated amount of anxiety just from being around people. And so it can manifest itself in a lot of different ways, right?
That's correct. There's lots of different ways we see anxiety. So it could be anxiety about a particular situation, could be, as you said, anxiety about being around people. So we think about anxiety as being different than fear. Fear is sort of a normal physical reaction to a real imminent threat. Anxiety is sort of a similar reaction about an anticipated future threat that may or may not actually manifest.
We live in a troubling world. You watch the news for a little while and you go, oh my goodness, I can't believe everything that's going on. It's always been that way, but we are bombarded with it from every direction now. There's enough stress out there in the world, enough things going on to cause us all anxiety. When you're dealing with people that you counsel and talk to or teach, how do you tell people to begin to deal with everyday anxiety so that it doesn't become a serious problem for them?
So the first thing I would say is to think about how it manifests in your life. And remember, like I said, that everybody deals with anxiety at some point about something. So the feeling of anxiety itself can be entirely normal. What makes it not normal or something that's concerning is when it causes you to make changes in your daily life. For example, if you in your commute to work every day had to go over one of the big bridges around here, and you had such anxiety about it that you drove far enough out of the way that it was a real impact on your job, that's something we would begin to think about as being an anxiety disorder. Or if your symptoms of anxiety about your job or about a relationship or something like that manifested over a course of about 6 months, then we might begin to think about that being an anxiety disorder.
Now, PTSD, the first I ever heard of it was in a military reference when someone would come back from combat. I think we called it by different names in World War II and Korea post that period, 40s and into the 50s. But PTSD now, it isn't just a military term. It affects a lot of people and is a real syndrome that we have to address. What do we know today? What do you know today that maybe we didn't know 20, 25 years ago?
So you're right. Initially, it was called shell shock.
Yeah.
And so that's kind of how it became to be sort of part of our vernacular. And now we call it post-traumatic stress syndrome, and or post-traumatic stress disorder. And it's an acute reaction to a particular stressful event or a series or a long-lasting stressful event. And it has a lot of the same symptoms of anxiety disorders, but it manifests also in some different ways. Typically, someone who has PTSD, we might expect those folks to have recurrent intrusive thoughts about the traumatic event. They might have nightmares about the event. We talk about a heightened startle response, so they're always on alert, always on edge. So those are some of the things that make PTSD different.
Growing up, some of my slightly older friends had fathers that came back from World War II, and they were troubled by what they'd been through. They had trouble functioning, had trouble talking to people, had trouble sleeping at night. We called it shell shock, didn't talk about it, and I don't think they were getting much help from anyone. They just thought, well, that's the way it is. What are you doing today? What are professionals like you doing today to really help people that deal with real PTSD?
So the first thing is to acknowledge that it's a real condition. So mental health conditions, by and large, people tend to not deal with because it's not the same as a broken leg or a cold or something like that. Mental health conditions are real health conditions, and they do need to be managed. They can be managed. So anxiety, depression, PTSD, all of those can be treated successfully. So the first thing I want to do is help somebody sort of normalize that, yes, this is something real.
It's not just them.
That's correct. That's correct. And we have a lot of different ways that we can work with folks. For me, it starts with a really good sort of diagnosis of exactly what's going on and if it's PTSD, what the precipitating event was or a series of events. But beyond that, we would start to think about lots of different ways to treat it. Things can be treated through pharmacology. They can be treated through talk therapies, and there are lots of other ways to intervene that have been shown to be quite successful, including things like meditation and yoga. So
I'll make this my last question for our viewers today. If they suffer from anxiety or elevated anxiety or PTSD or love someone who is, what's their best first step? General practitioner, or should they immediately come to a social worker environment to ask for help?
I would always encourage people to start with wherever they're most comfortable. And for most people, that's your general care practitioner, your family medicine doc.
And they know how to connect people with folks like you that can help and give guidance.
That's correct.
Thank you so much for your time today. It's a real problem. I can't imagine, other than a life-ending illness, anything more troubling to a person personally than dealing with these kind of issues. So thank you for sharing.
Thank you for having me.